Hello and welcome back to the podcast, wonderful technologist. Welcome back. Brand new week. Have to say, it is a very sunny day and spring is upon us. Hope you guys are getting a good start to the week. So, I have some really exciting podcast episodes that are coming up. So, you might get some weeks that I might drop two podcast episodes, some weeks one. So you'll just have to stay tuned to, make sure that you check those out. If you're not on my email list, make sure you get on my email list because I will regularly send out when these podcast episodes will be dropping and the dates. So if you haven't gotten on my email list, get on that email list, okay? So I'll make sure that there's a link in the show notes so you can get into my email list. So, in today's episode, I wanted to talk about, and I know I've talked about this topic quite a bit, and I feel it's important that we continue to have this conversation when it comes to training new and beginner CT technologists. So, today's episode is why 8 weeks of training is simply not enough for the new or beginner CT technologist. So I can honestly tell you, as somebody who had to kind of self teach themselves when it came to CT, even though I was trained on the job, but there was a lot of things education wise that I had to self teach myself. So I think we have to set up our new technologists, our beginner technologists for success. So I'm going to kind of dive a little bit in and just give you some tips and things that I kind of picked up as I was gaining experience, gaining education that I think will help you beginner technologists, you newbies out there that are just starting or been in the game for a year, whatever the case is, right? I think these tips will help you and to kind of just make you thrive while you're on that CT floor and, scanning your patients, doing your exams, and make sure you pump out quality exams because that's what we want so the patient gets the correct diagnosis, right? So I think the first thing is that we need to give technologists some more time. The reason I say that they need more time, now, not to say that somebody can't pick up the basics in 8 weeks. Of course, it's freaking possible. But we also have to remember that everybody has a different learning curve. Everybody digests information or absorbs or consumes information differently. So we have to be mindful and cognizant of that because some people take time to really learn and process. Other people are very visual and they're like, okay, just show me how to do it. I can go ahead and do it. Me, I'm kind of a mix of both. I'm a very visual person where I need to see, but then I need to sit down at the console and actually do it myself. So, and I do, like when I was a beginner, I wrote a lot of notes. I could probably pull out behind me out of one of my bins just the notebooks in CT that I took and everything that I wrote down. So I think it's very, very important that we have like a system or a framework as far as how to really just integrate and incorporate them so they are successful in the modality. Because I can tell you, I've been a CT tech for a very long time. And every hospital that I've worked at, and I've worked in different sectors of radiology, whether it's government, whether it's through the state, whether it's trauma, you know, a network of hospitals, high acuity, outpatient. I've done it all. The thing is that there is really what I have found is there really isn't like a concrete framework or structure that a beginner can or a new technologist that's probably been in a year, maybe less, maybe a couple years, that they can follow when they go to a new establishment, or if they are taking a CT program and they're doing clinicals, or if they're cross training from X ray to come into the CT modality because the departments do need help. So what I think it's important is that we have a structure or a framework that they can go ahead and adapt and follow, so they get the basics down to a science. They know exactly how to set up their room correctly. They know exactly how much contrast, what protocol to select, what to do in the case of extravasations, infiltrations, IV gauges, the rates, the flow rates, how to use a power injector. I mean, those are things that are very, very simple and that every new technologist really needs to know. I think with these CT programs, and I know I've talked about this in previous episodes, I think with CT programs, the downfall that I commonly see is that, yes, we push a lot of physics and we push the technical stuff and all the stuff you need to pass the test. Trust me, those things are important. However, it's when they get to that clinical site, they need to know what the basics is, as far as just the simple stuff, setting up the room and knowing which protocol to select. And I think that's where we do a disservice. And that's where we need to just really just narrow in and help them. That is the purpose of the coaching program that I have created, because we are going to narrow down. We're going to get you going on the basics. We're going to make sure you learn that shit, okay, to a science, because that's exactly what you need. That is like the meat and potatoes of CT scanning. Now, as we go along in the coaching program, yes, you're going to get the technical stuff, the why, the all the advanced stuff. However, you need to know how to scan, how to set up, what to set up in your room, how much contrast, what the flow rate is, what kind of IV, if it's good, bad, etc. Those are the basics that I concentrate in my coaching program, and I mentor you throughout the entire 6 months that you are in my program. So if you're interested in that, make sure you check out the show notes at the end of the episode, and I will have the details for that coaching program. Okay. Now, another great tip is that you new technologists and the beginners, you need to speak up, because if an employer gives you, okay, you're going to get 6 weeks of training, you're going to get 8 weeks of training, and you don't feel that that's enough, and you are not confident and you are not comfortable to be on that floor by yourself, you need to speak up and say something. Can't tell you how many times I have seen new technologists make a serious fatal mistake when they are scanning patients, and they say, well, nobody taught me how to do that, and I asked for more time, but they told me no. No, you need to speak up, because it is potentially dangerous and it can be very fatal if something happens to the patient. And the patient is entrusting you to make sure that the technologist that is taking care of them, that they have the knowledge, the skill, and the experience to make sure that they execute that exam and the patient goes back to their room, the ER, and gets back to their family. So that is one common thing that I have seen in my entire career. Can't tell you how many times I've seen new technologists not ask questions. You have to ask questions, and you have to make sure that you speak up when you are not comfortable. If 8 weeks is not enough, say that. If you say, hey, I need more time because I'm not comfortable and I want to make sure my patients are safe, you say that. And if they give you the answer, well, that's all you're getting, go above them. Trust me, I've seen technologists do that. Go above them, talk to somebody else. And if you don't feel comfortable at all where you're going to, do your job properly and help out in this modality, then guess what? You don't have to do it. Okay. I've seen technologists and say, no, you didn't give me enough time. This is not safe. I am uncomfortable. So they've gone back to x-ray or they've gone back to MRI, and they say no, because there's a code of ethics and just from a comfort level and a patient safety level that we have to maintain. So don't be afraid to speak up. Okay. The last tip that I'm going to give you before I wrap up this episode, make sure you take a lot of notes. I cannot tell you because your brain cannot consume the amount of information and the amount of data that we produce in CT. It is a lot. That's why it's called an advanced modality. That's why, it's a step up from X-ray. You cannot physically contain all that information in your brain. So, what I would recommend is carry a small notebook, put it in your pocket, make sure you have a pen on you. And when something comes up in your learning, make sure you write it down because you never know when you have to reference it. Listen, I have been a tech for 21 years, okay? I still ask questions to this day because you're going to find technologists within that department. They all have different experience. They've all been trained differently. They've come from different facilities, different types of, departments. So, it's always good to ask questions, write things down, okay? Just write things down because if you're a visual person like me, yes, I see it, but I need to write it down too so I can remember it. CT is a very complex modality. There's a lot of things going on and a lot of things that you have to remember. So make sure you keep a notebook, flashcards, whatever the case is, because you may have to refer back to it. And don't be afraid to ask a lot of questions, okay? That is what's going to set you up for success as a successful technologist that you can advance into other things. But you have to make sure that if you don't understand something, that you ask, write questions down, write things down, educate yourself on how to execute things properly. So that is all that I have for this episode. I hope it was really helpful and insightful. Thank you so much for continuing to listen to this podcast. Please like, share, subscribe. Let your other CT peeps know that this podcast exists because without you, it wouldn't be possible. So if you're interested in my coaching program, make sure you check out the links below. I will go ahead and leave some information there. Get on my email list so you know when these podcast episodes drop. Make sure you follow on Instagram, follow on TikTok, because now I have TikTok as far as the CT educator. So all the links will be in the show notes. So make sure if you have any questions, reach out to me, whether it's DM, email. And I also have the website where you can get all your CT needs taken care of as far as courses, ebooks, PDF downloads. Please make sure you check those out. And hopefully that will help you in your CT journey. So thank you so much for listening to this episode, and I will talk to you in the next episode.